Hello, I am Dr. Teresa Maxwell, and many people know me by my married name, Teresa Church. I have practiced medicine here in Dalton for 40 years. I am retired now and doing volunteer work, but I was a medical oncologist and hematologist, which is cancer and blood disorder care. I am vaccinated against the coronavirus, and my family is vaccinated, including a pregnant daughter, and my grandchildren will be vaccinated. They're too young right now, but when the vaccine is approved for children, they will be vaccinated because we believe in this vaccine. Now, as you know, the coronavirus has resulted in 4 million deaths around the world and over 600,000 in the United States. Now, we were improving with vaccination, but now we're going back again to the masks and more precautions because of this Delta variant. And that's what I want to talk to you about today. It's some stats on that. Now in this country, 80% of people who become infected with the Delta virus have not been vaccinated, because the vaccine that I have is 90% protective. And 100%, nearly 100% of people with serious COVID infections, hospitalizations, and people who die of the virus, it's from the Delta variant, and they have not been vaccinated. Now, the problem with the Delta variant, it's highly contagious. It is 50% more contagious than the original virus was. It is called a gold medalist as far as being able to jump from one person to another. Even if I have the Delta variant and someone walks by me in a hall, they could actually get it from me just walking by, which was not true of the original virus. And this is why. There are 1,000 times more aerosolized particles in the air from just breathing with the Delta variant. And they can stay in the air for 16 hours in a closed space like this room. So here's a few more facts on it. Over half the people who have been hospitalized with COVID, any kind of COVID, have lingering disability for 3 to 4 months after the infection. Breathing problems are common. And in this clinic, a few weeks ago, I saw a man who had had COVID, was hospitalized with COVID 4 months ago, and he had just weaned off oxygen. But he still had this hard, hacking cough day and night. And he said there's been no treatment that has helped him so far. Also, people are they have fatigue after having COVID. But some people actually get muscle weakness to the point they can't walk very well or they can't walk very far. Another problem is PTSD, post-traumatic stress syndrome, just like a soldier can get in combat. These people who have been seriously ill, they have been afraid they were going to die, they've been on a ventilator, they can get PTSD more commonly in men. Now, I want to ask you a question. Have you ever seen an active case of tetanus or lockjaw, as the lay term is, or polio? Unless you're very elderly, you have not seen those two diseases because they've been wiped out by vaccines against them. But when I was a child, I remember my great aunt, had polio. She didn't die of it, which was fortunate, but she had a twisted spine that made her very short and walk with a tremendous limp. And then a friend of mine had an older sister who died of tetanus. She was a senior in high school, went on a senior trip to Florida, cut her foot on a propeller, and died of tetanus. That vaccine did not come out until the 40s. Now we never see those two diseases or many other diseases because of vaccines. The coronavirus is not any different from those vaccines for all those diseases that we've all been vaccinated against. Now, we could possibly be alive because we've had all those other vaccines, and now we have this coronavirus that if you get it, you could die. You could spread it to your loved ones and they could die. You could spread it to other people and they could die. God has given us the gift of life. Why not get a life-saving COVID vaccine now? And just God bless you all, and please get the vaccine. Thank you.